In the world of marketing, few ideas have more power than the next big thing. With each new device, technique, and product that is released to the market, the popular media explodes in a flurry of activity, pushing out news of the latest breakthrough to the hungry masses. But how much of what we read, see, and hear about plastic surgery is real news, and how much is just marketing hype? The problem of marketing spin being presented as legitimate news is not new, nor is it confined to the plastic surgery field. After all, that's what good public relations is all about. And savvy journalists know this and have learned to do the due diligence necessary for accurate reporting. But today, the line between hard news and hard sell is less clear. The 24/7 nature of modern media demands a constant stream of content, and some reporters have been adept at packaging promotional materials as pure news. And that's risky, because patients today look to the television media for information more than ever before. For example, a local newscast in Dallas, Texas recently featured a doctor performing a procedure to transfer fat taken from the stomach area to increase the size of the breasts. At no point, however, did the reporter mention that the doctor was not a board-certified plastic surgeon, and the patient interviewed for the story was only 3 weeks out from her surgery. Not enough time to determine whether the procedure would have had a lasting effect. We spoke with Jeff Crilly, an Emmy Award-winning journalist and 20-year veteran of the television news industry, about what viewers should know when they see information about a new plastic surgery procedure on TV.
TV news becomes a headline service. There's only so much information that you can get into a 2 or 3 minute story. In fact, if you just took the words in a 2-minute story, it probably wouldn't even fill half a newspaper column. So it's not a lot of information. News is a starting point for the viewer. You take the information you get from TV news, and then you go to the internet and you start doing your own research. That's the beautiful thing about the internet, is that you can verify and check out stuff that you're hearing from TV news. I think TV news supplies a wonderful function in our lives. We're bombarded with information. We want to get as much as we can. But at the end of the day, TV news is a headline service, and your job as the consumer of news is to use that as a starting point to do your own homework.
In short, although television news reports can be an excellent source of information about certain procedures, always be sure to do your homework. And if you're considering an invasive plastic surgery procedure, make sure your doctor is board certified by the American Board of Plastic Surgery. And now it's time for some celebrity news. Would you believe that Heather Locklear is almost 50? It's true, the winsome blonde star of T.J. Hooker, Melrose Place, Spin City, and countless other productions is still a baby boomer, but still looks like she's in her mid-30s. She's got her good Scottish genes to thank for her enduring good looks. That, plus a wee bit of plastic surgery magic. Now, Heather Locklear has always had a nice figure, naturally slim and toned. However, a comparison of the photos of Heather over the years makes it almost certain that she's had a breast augmentation. Of course, many moms have had a trim and tighten after having a baby, and Heather Locklear became a mom in 1997 with the birth of her daughter Ava. Still, the difference in size and heft between then and now is a clue that Heather's chest has had a bit of star quality added, along with the basic repairs. And while Miss Locklear's elfin features are naturally attractive, some point of evidence of Botox injections, facial fillers, a possible neck lift, and perhaps a bit of fat grafting at the cheeks. However, Heather's eyes, while still attractive, bear the typical signs of early middle age, making it unlikely she's had anything done to them. All things considered, the all-American blonde icon has matured gracefully and appears to have a healthy relationship with plastic surgery, using it sensibly and only in the degree necessary to keep her in play as an actress and businesswoman. If only more Hollywood knockouts would follow the same game plan. And that's all for this week's edition of the Plastic Surgery Channel News. If you've got a story you think we should cover, be sure to drop us a line at news@theplasticsurgerychannel.com. And until next week, so long.